The CEO of the Northeast Community Care Access Centre, Richard Joly, recently took time to sit down and chat about the healthcare system with staff members from Northern Life and one of its sister publications, the Northern Ontario Medical Journal.
We are certainly encouraged by the recent budget in making seniors in Ontario the #1 priority. We are the only sector in healthcare that are going to receive an increase like they've announced to approximately 4% increase in CCAC budgets annually for the next 3 years. But there's also a commitment of this government to start shifting dollars into the community. When I say shifting dollars, it is from the largest player in the system, our hospital. Ask any senior, what do you want? And they'll say, I want to remain home and I want to remain in my own apartment, but I need the support, and that's where we are building those supports, but we need to do much more. We've designed the system in the last 50 years in Ontario, Canada, was designed as an acute care system. As acute episodes, was not designed for chronic disease management, prevention, promotion. I think that shift is occurring, and that's quite promising, actually, for the early baby boomers that are only 66 years old. Certainly is promising that shift is occurring in their generation. Yeah. Home first is a philosophy of care. So we're saying home first versus trying to guide a senior into long-term care prematurely. Let's try home first. About 55% of our home first clients, so 55% of those clients would have ended up in long-term care, but because of home first, they're staying at home. 45% are still going in long-term care, but we're delaying the long-term care admission. But they're still going in long-term care, but they're at least in the other program we call wait at home. So you're waiting at home versus an acute care bed, but that requires additional resources. There's a limited number that we can bring on this type of service for 90 days. But the success, that, in my view, is that 55% of our clients are remaining in their home, better quality of life, they're happier, they're with their loved ones. They would have ended up in long-term care 2 years ago.
So what's your stance on the need for these memorial beds in the Sudbury community?
I don't think that more beds, and I'll be very clear, is a solution. I think there's other initiatives that need to be put in place, and the hospital, I think, would agree. It's not more beds that are required in the system. It's more programs for them to remain in their homes safely, and making sure that the seniors that are being admitted in long-term care homes are long-term care home seniors, and not prematurely admitting a senior in those beds. Right now, approximately between 15 and 20% of our long-term care residents could be served somewhere else. Yeah. So you can imagine
such as the supportive housing,
assisted living, and so on, but that don't exist. When they don't exist in the community, you do go to a higher level of care. For example, so they need long-term care. There's no long-term care. They end up in the hospital. Higher level of care they require. Acute care is not for that senior. Same thing when they're going long-term care, but they should be in assisted living. So you can see that there's a whole domino effect, that if you don't have the right parts in the system, so it goes from community home care, supportive assisted living, long-term care, and acute care whenever you need it. So in the short term, until we have built that capacity, we're faced with significant challenges. And we're certainly trying to implement like home first, wait at home, those types of programs to bridge us to the real impact of the assisted living that we will have in the system.